So there's not a great deal of work out there in the world with regard to what political communities in different countries think about vaccination and mandatory vaccination. So what we do know is that in the US, there is a difference in people supporting vaccination and mandatory vaccination, where they're seeing the difference in the kind of libertarian right. Not surprisingly, they would prefer parents to be able to make their own decisions about vaccination rather than having the state tell them what to do. In 2013, a poll done in the UK showed that only 55% of people there were actually in favour of making the MMR vaccine compulsory. MMR being quite a good, I think, proxy vaccine to think about mandates in general, because obviously it's had a troubled history due to our friend Mr. Wakefield. But it's not surprising that there would be such low numbers wanting it to be mandatory on the basis that they don't have this history. And indeed there we saw on the conservative side of politics stronger support for making the vaccine mandatory, perhaps on the basis of kind of the conservative side of politics perceiving that one follows authority. So, medical authority says, this is safe, so therefore do it. So we're seeing the sort of the conservative side rather than the kind of libertarian side playing out there. There'd been no research prior to our project in Australia. There was plenty of research, well, not plenty, but some research looking at, parents and the general community's attitudes towards vaccination, but not looking at attitudes towards mandatory vaccination and putting the two together. So what we did in our study, we were able to access the Values Project at the University of Western Australia, which has a huge panel of people that we were able to access. So we had over 1,000 respondents to our study, and we asked them two questions. We started not by asking them about their views on vaccination, but actually going straight to the mandatory policy because we didn't want to prime them. So we asked them, we named the policy. One of the things that we found a little frustrating when we're trying to do our literature review and compare what other countries were doing was there were all these different words, compulsory, required, and it's like, well, what do these things even mean? So in our study, we wanted to name the policy so that we could both get a sense of, okay, they're kind of thinking about what I would refer to as mandatory vaccination, but we're also asking about the specific policy in Australia. So we named it and we said what it did, which is that it removes some financial entitlements from parents, and then we asked them whether they agreed with it or not. We had a 5-point Likert scale. The second thing that we did was to ask the people in the panel whether they thought vaccination was safe, effective and necessary. This was a very quick and dirty poll, if you like, so we only had the opportunity to ask a couple of questions. Asking about safety, effectiveness and necessity was a very good proxy for basically thinking, do you think is vaccination good? Is it a good thing? Those points had been used separately in other research in Australia. So we asked the two things in that order. What we found amongst our over 1,000 respondents to our survey questions was that only 4% of respondents didn't think that vaccination was safe, effective and necessary. And this pretty much aligns with what we would regard to be the sort of latent levels of vaccine hesitancy or vaccine refusal that have been measured in previous years before the no jab, no pay policy came in. We sort of, one estimate had sort of said that about 3.3% of Australian children were not vaccinated due to parental choice as opposed to lack of access. So that correlates quite well with that. And then we found that 9% of respondents didn't approve of the no jab, no pay policy. So there was a difference between thinking, a small difference between thinking that mandatory vaccination, or thinking that vaccination was a good idea and then thinking it should be mandatory of around 5%. But, what our study did find was a very high level of support for vaccination, which was great, but a high level of support for mandatory vaccination as well. It was highest amongst voters for the Coalition, which is the centre-right coalition in Australia. Probably not surprising because they were the party that introduced the policy in 2016. Also high levels of support for Labor Party voters. And again, that's sort of the policy has had bipartisan support. We saw we don't have a huge populist presence in Australia, although at certain elections it does. The populist One Nation Party does get a significant vote. And their leader, Pauline Hanson, has come out against vaccines in the past and has referred to no jab, no pay as a dictatorship. Even amongst her supporters, we found high levels of support for the policy, although we also found that there were the sort of 8% of her supporters disagreed with it, so it's kind of strong in both ways, if that makes sense. We also found, we were very interested to look at Greens voters, because in Australia we had the hypothesis that unlike the sort of unlike the libertarian right in America being a place that we would see some vaccine refusal, that we thought we would see that amongst Greens voters, opposition to both the policy and to vaccination. We found amongst Greens voters that there was the lowest level of support for both vaccination and for mandatory vaccination, but the numbers were so small in terms of people in the panel who identified as Greens voters, because they are a minor party in Australia. Our sample was not big enough for us to make meaningful inferences from this. But one of the things that we thought was that because Greens voters are, that they're a left party, not just in terms of environment and natural living, but also in terms of social justice. So there may be on that side of politics a lack of desire to punish people for not, complying with government requirements around vaccination, and the removal of financial entitlements could be seen as that. So what our study has shown, I believe, is the importance of looking at the relationship between voting patterns and political beliefs, and beliefs about vaccination and beliefs about mandatory vaccination in a specific country context. So, one might think that the US, Britain and Australia are not, remarkably different countries in terms of our values, in terms of our lifestyles, in terms of our political beliefs, although perhaps US as the outlier there. But certainly our study showed that vaccination has not had a role in being partisan political, that there is a strong level of support for the no jab, no pay policy. And in this paper, we've deliberately not sort of taken a line about whether we think the policy is a good idea, about whether we think it's likely to be effective. We simply wanted to look at, what do Australians think about this? And in particular, does this have the likelihood of becoming something that that is no longer bipartisan, that is favoured by one side of politics or the other, because that, of course, can then lead to it being attached to views on other things such as climate change, or indeed, as we had thought perhaps on the left, being attached to kind of alternative lifestyles and environmental values. And we've seen hints that may be the case, but as I mentioned, the numbers were really too small for us to draw those meaningful inferences.